First of all, I appreciate all of the press who have joined us today to hear from these nursing home workers and hear their stories and about the situation that we are in. So just appreciate you making the time. I'm going to do a little bit of context, and then we're going to hear from three workers directly about their experiences in this moment. So just to get us going here, there's 750 nursing home workers, which are nurses, nurses' aides, housekeeping, dietary, laundry, and maintenance workers from across 10 facilities that are preparing to go on an unfair labor practice strike if necessary. To be clear, Valley West has given these workers no choice but to hold a 3-day ULP strike. And why, you might ask? Because Valley West has refused to bargain in good faith. Since July, workers have been trying to negotiate a wage reopener, but Valley West has only come to the table once since July. And when this should have been done, frankly, by now. Valley West has canceled negotiations twice, one day in September, and then most recently canceled a bargaining session just this past week in the first week of October. Valley West has not provided any proposal yet, including a response to union proposals. Valley West has not provided information needed for the bargaining, even though we have requested the information to be able to bargain multiple times. Union workers have always been ready to negotiate in good faith. It's what we did in 2024 when Valley West took over. It's Valley West who is refusing to bargain in good faith. We should be on the same page. I wanted a little bit of context what's happening in the industry. We should be on the same page, frankly, in protecting and stabilizing and improving care. These workers protected residents through COVID. They continued to show up for the residents through the Guardian bankruptcy and then during a sudden sale of the facilities in 2024. Other operators have shown we can do better for residents and workers by working together. Because the strikes because the stakes are tremendously high for the Commonwealth to solve the crisis in long-term care, over 30 nursing homes have closed since 2020, and 32% of all nursing homes in the state have sold in the last 7 years. That's a tremendous amount of ownership change, and if you go back beyond 7 years, it's even more. There is high turnover in caregiving due to more work, to less staffing, and to low pay, and to the fact that these are physically and emotionally demanding jobs. While Valley West drags their feet, more than 60 other nursing homes around the state have reached strong contracts with wage increases. Valley West should come to the bargaining table to stabilize and improve care, not waste time and money at the expense of residents. We know that 70% of state funding must go to resident care, but Valley West has not submitted their cost reports yet and responded to our request for information. Workers, residents, and taxpayers deserve transparency and accountability around these public funds. Funds are spent on expensive agency staff that are not as familiar with residents as the full-time workers, and they're spending on purchasing new facilities and growing their company portfolio. Residents deserve safe, dignified care, and workers deserve respect and fair pay. Taxpayers deserve to know where our public dollars are being spent and how they're being spent on care and not on profits or on the ability to continue to purchase other facilities in other states. Couple things we're demanding: that Valley West respect workers' rights and respect quality care for residents. This means negotiating in good faith so we can together invest in care and the workforce. The bottom line really is we remain committed to working together for quality care if Valley West is ready to immediately negotiate in good faith. Caregivers are united, determined, and ready to do whatever it takes to secure a future of safe, dignified care in Pennsylvania. It's time for Valley West to show up for workers and show up for those who get up every day and care for the residents living in these homes. I want to now turn so you can hear from three workers directly. First, I'm going to go to April Chardon, a CNA from Hayda in Cambria County. April?
Hi, thank you, Matt. Good afternoon. My name's April. I've been a CNA at Hayda for almost 18 years now. Over those years, I've seen ownership change hands 3 times. Each change came with its own challenges, but I can say without a doubt, Valley West is by far the most difficult one so far, especially the way that they are disrespecting us in negotiations right now. The reason that we're here today is simple. They have been refusing to bargain in good faith. Our wage reopener expired back in July, but Valley West has only shown up to 1 bargaining session. Twice now they've canceled without ever putting a counter proposal on the table or providing the basic information we need to actually bargain. Meanwhile, they are wasting money handing out pizza, brownies, and donuts and calling that appreciation. But a donut doesn't put gas in a tank. A brownie doesn't pay for the electric bill, and none of it replaces real respect at the bargaining table. While they stall, residents and workers are paying the price. Valley West is cutting costs everywhere and calling basic care items luxuries. A tiny can of soda, gone. Snacks for the residents are limited. Supplies we need every day, like briefs and wipes, they're so scarce that we're left begging, borrowing, and bringing our own. The shampoo they provide is so cheap, it doesn't even work. We end up buying our own just to make sure that the residents feel clean. This ultimately all comes back to our residents, the people we care for every single day. We will never apologize for fighting for what they deserve: quality care, adequate staffing, and dignity. So let me say this clearly to Valley West. You have the power to stop this. All you have to do is show up and bargain in good faith, like you promised that you would. Until then, we will continue to stand up for ourselves, for our residents, and for the care every single day, or every single Pennsylvanian deserves. Back to Matt.
Right. Appreciate your work here, April, and all of the work of you and your coworkers at HADA. So just appreciate you speaking out here to the press today. Let me turn now and ask Tyreka Tate, a dietary cook for 40 years at Walnut Creek in Erie, to come on and share her perspective and story here. Tyreka, take it away.
Hello, my name is Tyreka Tate. I work in the dietary department at Walnut Creek. I've been in dietary for the past 40 years. I fed residents and made sure they get their meals they need, and I can tell you, I've seen a lot of changes over the years. I work in the kitchen, but I see what's going on across the facility, and what I see doesn't make sense. Valley West will not bargain in good faith. We are prepared to strike if necessary, but we don't want to. Nobody here wants this. Valley West has left us no choice. We are standing up because of unfair labor practices by Valley West. We are doing this for our residents, ourselves, and for the public dollars that should be going into care and not to profits, not to software and not into buying more facilities while leaving the ones they already own understaffed and underfunded. They tell us they don't have money for a $2 raise for people who care for the residents, but at the same time, they can afford to pay expensive agency staff. They have money for that, but how do they not have money to invest in us? The people who are here have been here year after year showing up for the residents. In my department, they cut the food budget, but then ask us to prepare more food. We're told to make 4 different sandwiches plus hamburgers, hot dogs in the main meal, and most of it ends up in the garbage. That waste puts us behind in our work, and again, it costs money. We are asking for is respect, to be compensated, and sustainable wage, not even a full contract.
Mhm.
Not even a full contract negotiation, but Valley West won't even come to the table. This is disgraceful. All we are looking for is to be kept up with the market, something dozens of other homes have already agreed to. Instead, ever since they heard we were taking action, Valley West has wasted money on ice cream trucks and giveaways and pizza. I wanted one of the giveaways. Tell me, what am I going to do with a kayak? It can't pay my bills. It can't take care of the residents. I'm proud of the work I've done, and I care I've helped provide and the help I helped provide, but Valley West needs to understand, if they want to run a nursing home in Pennsylvania, they need to respect the workers who keep them running. And until they do, we will continue to stand together and fight together for what's right. Thank you.
Right.
I'm handing it back to you, Matt.
And Tyreek, I really appreciate you and appreciate 40 years of getting up every day and making sure folks have a hot meal and the care they deserve in a nursing home. So just appreciate your leadership. And just for the press, Tyreek is going to have to jump to go back to work. She's on a lunch break, but we can connect if you want to speak directly to Tyreek coming off this call. We can make sure that we can make that connection for you. So again, I just appreciate your leadership and 40 plus years in this industry, Tyreek. Let me turn now to Tiffany Cothran, a CNA at Waynesburg. Tiffany, you want to take it away?
Thank you so much, Matt. And Tarika, April, thank you. Then my heart hurts for your facilities. But good afternoon. My name is Tiffany. I'm a CNA at Waynesburg. My number one priority at all times is our residents. I love them. Every day I head to work, I think, how can I make somebody's day brighter? I honestly love what I do. I believe our residents deserve consistency. Familiar faces, steady routines, people who know them and love them. They can't just get up and leave when the care is bad, you know? This is their home. But I'm worried because Valley West has not been bargaining in good faith. In fact, they aren't even showing up to bargain, period. Valley West says they can't afford raises because the last owner filed for bankruptcy. But let's be clear and keep things in perspective. They bought 10 nursing homes at once and are in they're about to buy 4 more. I hear Valley West says I hear the CEO is investing in AI software and buying up more nursing homes in our state. We've got people in administration in my building who have taken multiple international trips over the past year. So how is it possible that they can't afford $2 an hour for the people that are providing the care that these residents so desperately need? How is it possible that we're running out of wipes, we're running out of briefs? It's crazy to all of us. I've been told multiple times that they don't have a company handbook, or they do, and the policies are just so abundant that they can't print any of them out for us because it's just too much. And now they're talking about eliminating positions, cooks, drink aides, and serving frozen meals. Think about that. People come here for rehabilitation, for care that restores their health and dignity. This isn't just about money. It's about the quality of life for the people who live here. We're not asking for the world. We're asking them to bargain in good faith. We're asking for fair raises and respect. And we're standing up today because we know our residents deserve better. And we won't stop fighting until we get what they deserve. Back to you, Matt.
Great. Really appreciate your leadership as well, Tiffany. I appreciate you sharing your story with the media here. So we're going to turn now, I'm going to turn it back over to Emily and have Emily be able to take some questions from the media that are on.
Thanks, Matt. I'm just going to do it chronologically in how I received these questions. Yes, I want to thank the press for reporting on what's a really important issue, and also, of course, to our union members for speaking out. First, we have, I think he's still on, Russell Riley from the Tribune Democrat. This, I think, might be for you, Matt, which is, he had a question about how does the federal government shutdown affect our filing of unfair labor practice charges?
Yep. Yeah, it's a good question. And I would just say, first off, these charges are already filed. I believe we'll have some additional ones coming, but we filed charges back in August, so they were in prior to the government shutdown. So, and as I've said already, the strike is really a strike around unfair labor practices and the company's refusal to actually hold up their end of the bargain and actually bargain in good faith in this wage reopener and this contract.
Good. Thank you, Matt. And then, okay, second question is from the Lewistown Sentinel, from Brian Carson with the Lewistown Sentinel. First question, so there's a two-parter. First question is, how can Pennsylvania ensure public nursing home funds go toward resident care rather than corporate profit, which is an important question. April, did you want to take a stab at that?
Sure. So we are lucky because we are union members. So we get to go to the table and bargain. We have a voice. We have a say in how those tax dollars that the employer receives get spent. So with things like recruitment and retention, so we can retain the best caregivers for our residents because everyone knows that staffing is an issue. That's why it is such a big deal for us that Valley West is not negotiating in good faith and that they are not coming to the table. Because to be clear, we don't want to go on strike. So Valley West has the power to end this by simply coming to the table and bargaining in good faith.
And second question from the Lewistown Sentinel is, what's the most urgent step to stabilize the nursing home workforce as Pennsylvania's population ages?
So I think that more training is necessary for quality of care for residents. We need to make wages more competitive because look, these jobs are not easy. They're not for the weak. The jobs are very physical. They're physically, mentally, and emotionally hard. So without the competitive wages, people don't want these jobs. They don't want to work these jobs. So we need to get more people in. That's why we're asking Valley West to respect us by coming to the table and bargaining with us in good faith.
And Tiffany, Matt, was there anything you wanted to add to the two questions from the Lewistown Sentinel? I know besides just Valley West, like this is a big concern of the unions,
Sure.
a big focus of ours.
Yeah, Tiffany, do you want to add anything? If not, I have a couple things, but go ahead first.
Go ahead. You know what? I'm on board with April training.
Got it.
Is, I mean, she really hit the nail on the head.
Yeah.
This is a demanding job,
Yeah.
physically, emotionally. This isn't walking into a gas station and smacking on a register for 12 hours, and they're getting paid a little more than we are.
Yeah.
And so keeping those wages competitive, I mean, it's sad to say that nursing is a dying field, but there's nothing that is appealing about it anymore, especially with politics and whatnot, except, the people like myself, April, people with heart is, what they need.
Right on. Yeah, totally agree with both of you. And I would add a couple things. One is there is a care ratio that is a process in which employers are required to send documentation to the state to DHS to verify that they're spending 70% of their Medicaid dollars on bedside care. And so, as I said in the framing in the opening here, we cannot get Valley West to respond to our information request. It's part of the ULPs. And as our understanding is, they have not submitted how they've been spending their Medicaid dollars to the state as of yet. So that is one requirement that I think is really important, as we move forward in Pennsylvania. And the other thing I did in my framing as well is we've been able to reach agreements with 60 plus, providers. And I think folks probably saw this earlier in the year, but we also, we have a partnership. We have a strategic partnership with what I would say is like responsible operators. And we are working in partnership to try to make sure that we are stabilizing rates and making sure that we are lifting up employers that are doing the right thing by investing the resources at the bedside and frankly, working through labor management partnerships. So those are some of the other ways and solutions on how do we, resolve some of the crisis that we're experiencing in this industry.
And I think the last two questions are coming from the Altoona Mirror. One, I think might be for you, Matt. The first is a question of, and then feel free, Bill, to, if we don't get the question right, feel free to ask follow-up questions. The first one is explain the legal requirements at issue in the union's invocation of the wage reopener, please.
Yeah, so we have a 3-year contract with this company. And as part of that 3-year contract, we agreed that we would do a wage opener in the second year of the agreement, which was set to have happened July. So essentially, and the agreement was that the no strike clause would be waived, during that period. And I just want to be clear again, that they have not bargained at all in good faith. And so the collective action that workers are choosing to take, and again, no one wants to be in this position, is to have a 3-day ULP strike because they are not holding up to their end of the bargain and actually bargaining in good faith over the wage, reopener.
And the second question from the Mirror is actually, I think it's similar to the one that was asked by the Lewistown Sentinel. I'll just ask it again and see if there's anything you guys felt like you missed that you want to add back, which is what state funding intended for bedside care are you guys talking about, and what has Valley West done or not done with it?
Yeah, again, it's hard for us to know what they've done or not done with it because they're not providing any information to us, and I believe they are not providing the information they're required to the state. And it would be their Medicaid funding. There's a rule that's in fiscal code that says it was called a care ratio that skilled nursing facilities need to report to the Department of Human Services at least 70% of their Medicaid dollars being spent on bedside care. And that's an annual report that they need to produce.
Okay, we have two new questions. One is from WJAC from the Johnstown area. Hi, Bailey from WJAC here. Can you tell me how many workers in Cambria County are part of this movement and how many seniors will be impacted? And I think, April, correct me if I'm wrong, it's 2 homes in Cambria County. Where's it 1? I think it's two.
Haida and
Richland.
Richland.
So it's two homes, and I can follow up with you, Bailey, of the exact numbers of workers who would be part. I'll follow up with you directly. I have your email. And then I can also follow up with you with some research on how many seniors and residents are in these homes and how many beds.
Yeah, and I would just say we've provided the 10-day required notice as healthcare workers to make sure that the employer has the ability to plan for the care of the residents, when the workers are on their ULP strike. So just to remind folks, for healthcare workers, we're required to give a 10-day notice so that the employer has the ability to have a contingency plan to make sure care is continued to be provided during the work stoppage.
And last question is from Garrett Neese. I think Garrett is from it's from Greene County, a outlet in Greene County. So Tiffany, it might be good for you to speak here. Do you have a target for what level of wage increases you'd like to see to make pay more competitive? So Tiffany, Matt, April, feel free to chime in here.
Well, at this point, I mean, we're just open for a discussion. We'd just like to have a discussion. We're not really looking at anything. I mean, me personally, I'm more interested in sitting down. I mean, $2, I believe, is what we were bargaining for, but really, we just want to have that talk. That's all we want, Matt?
Yeah, April, do you want to add to that at all? Yeah,
I was just going to say, I agree. It's hard to come to a number because they're not even bargaining with us. So you can't bargain with yourself.
It's right. In the email,
we need them to participate.
And in the email that Valley West had put out, they value our time and our loyalty, and with the actions that they're taking, I don't personally feel that. I think that actions speak louder, and coming and having a discussion with the the oil that makes your motor run is bad decision on their part. So
yeah. And I would just say, I mean, again, like, this is the whole point here is they're not negotiating at all. And so we have an opening proposal of $2 an hour. I think you can hear, just listening to April and Tiffany and Tyreek when she was here, like, these are reasonable humans that get up every day and take care of other people who can't care for themselves. And so the least you could do is have some respect, show up and bargain in good faith. And then folks will determine, what the end number's got to be. The opening number was $2 in this moment, and that was an opening number. So again, the reason that we are here, the reason that workers have decided to take this 3-day action on this ULP strike is because the company is not bargaining in good faith as they are required to do.
I think that's it for press Q&A. I will give it, I was going to give it a few more seconds, and WGAC is slid right in there. Another follow-up question from WGAC is, what's your response to West Valley? I think Valley West saying that what the union is doing is quote unquote reckless, and that they remain open to a scheduled dialogue. They say that they have a scheduled negotiation October 16th.
Yeah, I think it's I just think it's disingenuous and disrespectful. We've been at this since the early summer, trying to actually, have a bargaining relationship with this employer, and they have literally refused to do so. And so now when workers have decided that they're going to have to take action to get somebody's attention, they're trying to say now that it's like the workers are being reckless. What's reckless is not actually getting in it and bargaining in good faith with your workers. That's what's reckless. So I just think that that's disingenuous, and nobody is getting up playing games here. These people work incredibly hard taking care of the most vulnerable people in our community, and they deserve to be respected. And that's why we're here.
April, Tiffany, anything you want to add?
I completely agree with Matt. That statement is very dishonest. We have been at this since the middle of summer. They have proposed dates that they would like to come to the table for themselves. We've agreed to them, and then they've canceled their own dates. So this is, that's and I think it's very convenient that they want to have that meeting on the day after this strike is supposed to take place. That seems very convenient to me.